Don't stop. Don't stop.
Preliminary consideration of boundaries and contents of pelvis. Introduction. Pelvis is formed by articulation of each of the two hip bones with the sacrum behind and with each other in front. The greater pelvis is comfortably occupied by the abdominal viscera, leaving only the lesser pelvis for the pelvic viscera. Urinary bladder lies behind pubic symphysis, rectum and anal canal are close to the sacrum and coccyx. The middle space left is for the genital organs. Many structures cross the brim of the pelvis, i.e. curved line extending around the pelvis at the junction of greater and lesser pelves, linea terminalis. The bony pelvis is formed by door bones united at 4 joints. The bones are the 2 hip bones in front and on the sides, and the sacrum and coccyx behind. The joints are the 2 sacroiliac joints, the pubic symphysis and the sacrococcygeal joint. The pelvis is divided by the plane of the pelvic inlet or pelvic brim, or superior aperture of the pelvis into 2 parts. A upper part is known as the greater or false pelvis. A lower part is known as the lesser or true pelvis. The plane of the pelvic inlet passes from the sacral promontory to the upper margin of the pubic symphysis. The greater or false pelvis includes the 2 iliac fossae, and forms a part of the posterior abdominal wall. The lesser or true pelvis contains the pelvic viscera. Lesser pelvis. Pelvic walls. The pelvic walls are made up of bones, ligaments and muscles. Bony walls. These are formed by, 1 anteriorly by the pubic symphysis and bodies of the pubic bones. 2 posteriorly by the sacrum and coccyx. 3 on each side by the 2 rami of the pubis, the ischium with its ramus, and the lower part of the ilium. Ligaments and membranes. 1 obturator membrane closes the greater part of the obturator foramen, and completes the lower part of the lateral waffle of the pelvis. 2 sacrotuberous ligament and sacrospinous ligaments bridge the gap between the hip bone and the sacrum, and convert the greater and lesser sciatic notches into the foramina of the same name. Muscles. 1 The obturator internus with its fascia reinforces the lateral wall of the pelvis from the inside. 2 The piriformis with its fascia forms the posterior wall of the pelvis. It also helps in filling the gap of the greater sciatic foramen. Pelvic inlet, superior aperture of pelvis. The pelvic inlet is an oblique plane, making an angle of 50 to 60 degrees with the horizontal. It is bounded posteriorly, by the sacral promontory, inferiorly by the upper margin of the pubic symphysis, and on eoc side by the linea terminalis. The linea terminalis includes the anterior margin of the ala of the sacrum, the arcuate line or lower part of the medial border of the ilium, the pectineal line of the pubis or pecten pubis, and the pubic crest. The pelvic inlet is heart-shaped in the male, and is widest in its posterior part. In the female, it is oval, and is widest more anteriorly than in the male. Posteriorly, the inlet is indented by the sacral promontory, more so in the male than in the female. Pelvic outlet, inferior aperture of pelvis. The pelvic outlet is bounded, anteriorly, by the arcuate or inferior pubic ligament. Posteriorly by the coccyx, on each side, by the ischiopubic rami or side of the pubic arch, the ischial tuberosities and the sacrotuberous ligaments. The posterior part of the outlet is formed by the cocci and the sacrotuberous ligaments. It is mobile on the sacrum, and the sacrum itself is slightly mobile at the sacroiliac joints. The pubic arch is formed by the ischiopubic rami of the 2 sides and by the lower margin of the pubic symphysis, which is rounded off by the arcuate pubic ligament, Fig 29.2. The pelvis is a basin with its various walls and many openings. The posterior wall contains 5 pairs of anterior sacral foramina. The greater and lesser sciatic notches are converted into foramina of the same name with the help of sacrotuberous and sacrospinous ligaments. Greater sciatic foramen is the doorway of the gluteal region. Pudendal nerve enters the region through the greater sciatic notch and quickly leaves it through lesser sciatic notch to enter the perineum. The lateral wall contains obturator foramen for the passage of obturator nerve which supplies adductors of the hip joint. Fracture may occur in the true, ring-like, pelvis. If fracture is at one point, the fracture will be stable. In athletes, anterior superior iliac spine may be pulled off by forcible contraction of sartorius. Similarly, anterior inferior iliac spine or ischial tuberosity may get avulsed by the contraction of their attached muscles. Pelvic floor. The pelvic floor is formed by the pelvic diaphragm which consists of the levator ani and the coccygus. It resembles a hammock, or a gutter because it slopes from either side towards the median plane where it is traversed by the urethra and the anal canal, and also by the vagina in the female. The pelvic diaphragm separates the perineum below from the pelvis above. Pelvic floor formed by two gutter-shaped levator ani muscles supports the pelvic viscera, especially during raised intra-abdominal pressure. The fetal head travels in the axis of pelvic cavity. During second stage of labor, the head of the baby on reaching the pelvic floor rotates from earlier transverse position to the antero-posterior position. The occiput moves downwards and forwards and reaches below the 80°-85° angled pubic arch. Then the head passes through the anterior hiatus of the levator ani to reach the perineum and then deliver. Sometimes episiotomy is given to enlarge the perineum. Injury to pelvic floor, which mostly occurs during vaginal delivery, may cause uterine, vaginal, or even rectal prolapse. Appendicitis occurring due to pelvic position of the appendix may irritate the obturator nerve, leading to referred pain in the medial side of thigh. Inflammation of ovaries may cause referred pain in the medial side of thigh due to irritation of the obturator nerve. The second to fourth sacral nerves and coccygeal nerve can be anesthetized by the anesthetic agent put into the sacral canal. It is called caudal anesthesia and is used in obstetrics practice. Pain in the sacroiliac joint is felt on pressing the posterior superior iliac spine present in a dimple on the lower back. Pelvic cavity. The pelvic cavity is continuous above with the abdominal cavity at the pelvic brim, and is limited below by the pelvic diaphragm. The cavity is curved in such a way that it is first directed downwards and backwards, and then downwards and forwards, J-shaped, as shown in. It has unequal walls, measuring only about 5 cm anteriorly and 15 cm posteriorly. The cavity is more roomy or larger in the female than in the male. Contents. 1 sigmoid colon and rectum occupy the posterior part of the pelvis. 2 urinary bladder lies anteriorly. The prostate lies below the neck of urinary bladder. 3 in between the bladder and rectum, there is a transverse septum or genital septum made up of connective tissue. In the male, the septum is small. It contains the ductus deferens, the seminal vesicle and the ureter on each side. In the female, the septum is large, and contains the uterus, the uterine tubes, the round ligament of the uterus, the ligaments of the ovaries, the vagina, and the ureters. These contents are considered in detail in the chapters that follow. Structures crossing the pelvic inlet/brim of the pelvis. From posterior median plane sweeping laterally and anteriorly. 1 median sacral vessels. 2 sympathetic trunk. 3 lumbosacral trunk. 4 iliolumbar artery. 5 obturator nerve. 6 internal iliac vessels. * medial limb of sigmoid mesocolon with superior rectal vessels left side only, 1 ureter. 2 sigmoid colon. 3 ovarian vessels in female. 4 ductus deferens in male/round ligament of uterus in female. 5 lateral umbilical ligament. 6 medial umbilical ligament. 7 autonomic nerve plex uses. 8 coils of intestine and pregnant uterus. Full urinary bladder axis of pelvic cavity is J-shaped. Plane of outlet of pelvis makes an angle of 15 degrees with the horizontal plane. Plane of inlet of pelvis makes an angle of 50 degrees 60 degree with the horizontal plane. Shallowest wall of pelvis is its anterior wall. Distance between two ischial spines is the least.